Staphylococci. They comes under the family Micrococci, consist of gram-positive cocci arranged in tetra clusters. Genus Staphylococcus. Term Staphylococcus derived from the Greek staphyli, bunch of grapes, coccus, which is berry, meaning bacteria occurring in the grape-like clusters or like berry. While speaking about the history, Robert Koch is the first one to see the Staphylococcus in pus. Louis Pasteur, he is the first to cultivate in liquid medium. Sir Alexander Armstrong named the bacteria as Staphylococcus. Classification. Based on the pigment production, they are classified into three. Staphylococcus aureus, which is golden yellow pigmented colonies. Staphylococcus albus, which is white colony. Staphylococcus citrus, which is lemon yellow colony. Based on the pathogenicity, whether they are pathogenic or non-pathogenic, they are classified into two types. Pathogenic, this includes only one, Staphylococcus aureus. Non-pathogenic, Staphylococcus epidermidis, Staphylococcus saprophyticus, Staphylococcus albus, Staphylococcus citrus, Staphylococcus hominis, etc. Based on the Coagulus production, the coagulus positive is S. aureus, coagulus negative epidermidis and saprophytes. Coagulus positive is S. aureus and coagulus negative is S. epidermis and S. saprophyticus. S. aureus, they are the natural habitat which are present in the nostril and skin. Their morphology is gram-positive cocci, which is 0.5 to 1.5 mm in diameter, occurs characteristically in group, also singly and in pairs. They form irregular grape-like clusters since divided in three planes. They are non-motile, non-sporic, and few strains they are capsulated. Culture. They are aerobes and the facultative anaerobes. The optimum temperature for the growth is nearly 37 degrees Celsius. The optimum pH for the growth is 7.5 degrees Celsius. 7.5. On nutrient agar, they are grown as golden yellow and opaque colonies with smooth glistening surface 1 to 2 mm in diameter, and the maximum pigment production is 22 degrees Celsius. Culture. On the blade agar, they are golden yellow. This is the nutrient agar and this is the blade agar. They are golden yellow colonies surrounded by the clear zone of the hemolysis, beta hemolysis, especially when incubated in the sheep or rabbit. The blade agar in atmosphere of 20% of the CO2. On Mac conch agar, the smaller colonies than those on the Na 0.2 to 0.5 mm and are pink color due to the lactose fermentation. On the mannitol salt agar, S. aureus ferments the mannitol and appear as a yellow colonies. MSA is a useful selective medium for the recovering S. aureus from the fecal specimen when investigating the food poisoning. Biochemical properties. Catalase positive and oxidase negative. Ferment the glucose, lactose, maltose, sucrose and mannitol with the production of acid but no gas. Mannitol, the fermentation carries diagnostic significance. Biochemical properties. Indole test, they are negative. MO test positive. VP test positive. Urease test positive. Hydrolase gelatin reduces the nitrate to nitrite. Phosphatase positive. DNA test positive. Coagulase test is positive. Virulence factor. The cell wall is associated structure, extracellular toxins and coagulase. Cell wall associated structures like peptidoglycan, capsule, protein A, clumping factor, bound coagulase. Extracellular toxins like hemolysin, leukodystine, enterotoxin, TSST, exfoliation toxin. Coagulase like staphylokinase, DNase, phosphatase, lipase, phospholipase, hyaluronidase, serokinase and protease. Virulence factor which are associated with the cell wall structure, capsule. They adhere to the host cell and resist the phagocytosis. Peptidoglycan, they inhibit the inflammatory response. Protein A, they bind to the Fc moiety of IgG, exerting the anti-opsomin which used for the antiphagocytic effect. Clumping factors like bound coagulase, they cause the organism to clump in the presence of plasma. While speaking about the extracellular toxin, the hemolysin, which is alpha, beta, gamma, and delta, they are hemolytic, dermonecrotic, and the leukocidal. Leukocidal Panton Valentine factor kills the WBC by producing the holes in the CM. Enterotoxin act on the ANS to cause the illness. Toxin shock syndrome toxin. They produce a fever, skin rashes, diarrhea, conjunctivitis, and earth to check. Exfoliation toxin. They breaks the intracellular bridges with the stratum granulosum of the epidermis and causes in the separation from underlying tissue, resulting in a blistering and exfoliating disease of skin. While speaking about the extracellular enzymes, 3 coagulase, they close the plasma by acting along with the CRF present in the plasma, binding to the prothrombin and converting the fibrinogen to fibrin. Staphylococcus, they decrease the fibrin clots. Hyaluronidase hydrolyze the acidic mucopolysaccharide present in the matrix of connective tissue. DNase, lipase, phospholipase, and protease. They degrade the DNA, lipid, and phospholipid and protein respectively. Pathogenesis, they adhere to the damaged skin, mucosa, or the tissue surface. At these sites, they evade the defense mechanism of the host colony and cause the tissue damage. S. aureus produces the disease by multiplying in tissues, liberating the toxins, and stimulating the inflammation. Clinical symptom: cutaneous infection, folliculitis, boils and furuncles, carbuncle, impetigo, wound infection. Like deep infection, they have osteomyelitis, periosteitis, and endocarditis. Exfoliated disease like toxin shock syndrome, staphylococcal food intoxication. Cutaneous infection like folliculitis. This is the inflammation of the hair follicles. A small red bump or pimple develops at the infection site of the hair follicle. Stye. A stye is a folliculitis affecting one or more hair follicle on the edge of the upper or the lower eyelid. Furuncle or boils. Furuncle, this is a deep-seated infection originating from the folliculitis. If infection extends from follicle to the neighbor tissues, cause redness, swelling, and severe pain. Commonly found on the neck, armpit, and groin regions. Carbuncle, it is the aggregation of the infected furuncles. Carbuncles may form the large abscesses. It is a large area for redness, swelling, and pain, punctuated by the several sites of a drainage pus. Impetigo, a very superficial skin infection common in the children, usually produces a blisters or sores on the face, neck, hand, and diaper area. It is characterized by the watery bristles, which become pustules and then honey colored crust. Impetigo with the vesicles, pustules, and the sharply demarcated regions of the honey colored crust. Deep infection, osteomyelitis, that is the inflammation of a bone. Bacteria can get into the bone via the bloodstream following on the injury. Clinical features like pain, swelling, deformity, defective healing. In some cases, they cause pus flow. Diagnosis like X-ray, MRI, bone aspirates. Periosteitis, inflammation of the periosteum. The clinical feature is fever, localized pain, and leukocytosis. Diagnosis: needle aspiration of the subperiosteal fluid. Endocarditis, it is an inflammation of the inner layer of the heart, the endocardium. Occurs when the bacteria enter the bloodstream, travel to the heart, and lodge on the abnormal heart valves or damaged heart tissues. Exfoliative disease, scaling of tissues in the layers, also known as the Staphylococcus skin scalded syndrome. Previously called the dermatitis exfoliata, pemphigus neonatum, Lyle disease, and the Reiter disease. Epidermal toxin produced by the S. aureus at the skin is carried by the bloodstream to the epidermis, where it causes a split in the cellular layer. That is, this toxin separates the outer layer of the epidermis from the underlying tissues. Toxic shock syndrome, caused when the toxic shock syndrome toxin liberated by the S. aureus enters the bloodstream. It is a multi-system illness characterized by high fever, headache, vomiting, diarrhea, conjunctival reddening, hypertension, skin rashes, and kidney failure. Staphylococcal food poisoning, caused when consuming the food in which the S. aureus has multiplied and formed endotoxin. The symptoms is nausea, vomiting, several abdominal cramp, diarrhea, sweating, headache, etc. Mode of transmission: person with the lesion, airborne droplets, asymptomatic carrier, and the cross infection. Prevention like wash your hands, keep wounds covered, reduce the tampon risk, avoid sharing the personal care items, cooking and storing food properly. Treatment and drugs like antibiotic therapy, wound drainage, device removal, and the removal of dead tissues. Laboratory diagnosis like hematological investigation, TLC total leukocyte count normal 4,000 to 10,000 cells per millimeter cube in case of infection greater than 10,000 cells per millimeter cube. DLC differential leukocyte count normal neutrophil is 80% in case of infection more than 80%. Bacteriological investigation specimen pus from wound or abscess or burns. Nasal swab from the suspected carrier. Food to diagnose the staphylococcal intoxication. Food to diagnose endocarditis and the bacteremia. Sputum to diagnose the lower respiratory tract infection. Culture and the isolation. The specimens are cultured on the VA plate and are incubated at 37 degrees Celsius for 24 hours. After incubation, the VA plate is observed for the significant bacterial growth that is greater than 2 mm in the diameter, and the gram staining is performed of the isolated organism, then subcultured on the NA plate for the further biochemical test. Tube coagulase test with 0.5 ml of a human plasma with 0.1 ml of an overnight blood culture as A aureus. It incubates the mix in a water bath 37 degrees Celsius for 3 hours to 6 hours. Plasma clots and doesn't flow if the tube is inverted. MRSA. Most strains of S. aureus, even those acquired in the community, are the penicillin resistant. Resistance of the attributable to the beta-lactamase production due to the genes located on the extra chromosomal plasmids. Some are resistant to the newer beta-lactamase resistant semisynthetic penicillin such as the methicillin, oxacillin, nafcillin. The resistance is due to the presence of unusual penicillin binding the protein in the cell wall of the resistance of strains. Infection of the MRSA is likely to be more severe and require the longer hospitalization with the incumbent increased cost than the infection with the methicillin susceptible strain. Coagulative negative Staphylococcus that are commonly implicated as a pathogen include the Staphylococcus epidermidis, causes the infection of the native heart valves and the intravascular processes. Staphylococcus saprophyticus, they causes a urinary tract infection mainly in the sexually active women that are less commonly implicated as a pathogen include Hominus hemolyticus, Cockney, Lugdunensis, Sacrolyticus, Scliferi, Simels, Warneri. Thank you.